Hello, beautiful people. This is Day and Night Podcast. Matthew coming to you. Mark is there in San Antonio. And
How's it going, everybody?
like I told you guys last week, we have two guests. So now you got two specials.
In a world of envy, analyze as these guys looks to see. They clones to the naked eye, the dynamic duo, no pesticides, they organic, day and nights the podcast. In panoramic in 4K, live streaming on your airwaves, no cliche to downplay, this ain't no child's play. Twin brothers close knit, but ain't a gang, personalities differ, like a yin and a yang, not alike, with certain views, philosophies and principles, inspiring nature's knowledge. Metaphysical, the sun, moons, and stars, mass attraction, affinity, the Big Bang Theory, the energy, infinity. Next we got Marcus, the opposite, laid back, chillin', kick back, laxed in a Cadillac, casinos and blackjack, bruise in a side chick, slick, sly, mischievous, surreptitious, no love lost between, they always bonding, they wonders of the world, they monsters, the twin Tompkins, brought on only born, they travel the world stomping at the break of dawn daily, the iron's pumping, my brain no brothers, about to bring you their life, look no further, everybody cause it's day and night.
You got Erica Roberts. Say hello, Erica.
Hello. I am Erica Roberts, your millionaire massage therapist at Massage World Med Spa.
Awesome. And then to the left, to the upper left corner is Angela Reese.
Hi, my name is Angela Reese, and I own Exec Level Massage and Beauty located in McDonough, Georgia.
Okay.
Thank you guys for having us.
All right,
Awesome.
thanks for coming.
Yes, thank you.
All right, so just like last week was the first part of massage benefits. So this is part two, and I worked with Erica about 2 years ago at Hands and Stones. Beautiful personality, high energy, and she's doing great things right now. She has her own practice. She started just with doing massage. Now she has her own school, and it's in McDonough, Georgia. For those of you out there, you have to check her out. Amazing. As soon as you step in there, the energy just is inviting, is loving. She starts off with a smile. You're going to leave with the same smile. So, I'm sorry. Go ahead.
Thank you, Matthew. Yes, Massage World Med Spa in McDonough, Georgia. Come and visit.
Okay. And then Angela, she was actually a client of mine. Same thing, beautiful personality. And that's what's funny about this, because the whole podcast is called Day and Night. Like Mark and I are twins. And with Erica and Angela, both beautiful personalities. Erica is not saying you're not outgoing, Angela, but Erica is outgoing. As soon as you see her, you know she's in the room. And then Angela, she has that sweet, that real good feminine energy, amazing people, excellent massage therapist. So I'm going to shut up for a minute, but like I said, I brought them on here because they're two excellent massage therapists, successful Black women. You know, they're doing their thing. And I believe Erica been in the industry for 20 years plus.
Yes.
And I'm sorry, go ahead.
20 years this year makes 20 years. Yes, you're correct.
Congratulations. That's huge, man.
Yeah, that is good. That's an accomplishment, yes.
Okay, so without further ado, Angela and Erica, y'all take the floor. By any means, just give the audience why is it important to have a massage? Like, what is the benefits of it? If someone to walk up to you today and like, I never had a massage in a day of my life, why should I get one? I keep hearing about it, but just why should I get it?
It's self-care. I mean, it's self-care and it's maintenance. You go and get your car maintained, you go and get your tune-ups, your oil changes. You have to get massage in order to maintain your body as well. In order for you to keep going from day to day and handle your stress. It's a stress management tool as well. And massage is important for those reasons.
Okay.
Angela?
To add to that, I think it helps as a preventative measure.
Mhm.
Helps to prevent injury, like you said, stress is like the number one reason that I get massage.
Mhm.
But especially if you're working out,
Right.
it depends on your posture, your everyday movements. You want to make sure if you're sitting for a long time or you're standing for a long time, you want to get a massage to help with that. Plus, it includes stretch therapy. I really think it helps with preventative of, it helps with your immune system, especially stress can lead to high blood pressure, right?
Yeah.
So that's like the number one reason that I think you should get a massage is to use it as a preventative measure.
All right. So like last week, I kind of talked about the different modalities that's with massage. Like before I even became a massage therapist, I just knew of one, and that was Swedish. I had no clue there was anything other than Swedish. So just like myself, I know there's people out there that don't know that there's other modalities that goes with massage. So if y'all could just talk about the other modalities and how is that important and why is it important to have one of these different modalities other than just Swedish relaxation massage?
Well, I specialize in lymphatic massage, and a lot of times with lymphatic massage, because I specialize in post-op care, post-op plastic surgery, women are more prone after plastic surgery to have cirrhosis, which is swelling, seroma, which is swelling of the tissues, as well as fibrosis. So,
That's a big one.
yeah, that's a big one. So with fibrosis, you all know, as massage therapists, when people go through plastic surgery, surgeons are cutting through the muscle, the connective tissue. So of course, the blood and the lymph fluid won't be flowing properly. So scar tissue lays down whenever there's trauma to the body in that way. So lymphatic massage is treated in post-op care to break up those scar tissues and those fibers, so that the blood can flow properly, and the blood, the lymph, and everything else can flow properly as well. Because whenever there's blockages with scar tissue and the blood and the lymph isn't flowing properly, then oxygen can't get through to the areas of the body, and then you can have, tissues and limbs dying because the oxygen is not getting to the connective tissues and the organs. So, lymphatic massage is my specialty. And because I am now a board certified instructor, national board certified instructor, I teach it as well. But yeah, you have a lot of different modalities. Deep tissue, I know you had mentioned in your previous podcast, deep tissue is good, but a lot of people don't know about neuromuscular therapy. Some people use neuromuscular therapy with tools, like wood tools, in order to break up fibers and get the blood flowing correctly. But there's so many different layers to massage and the reasons why people need massage in order to get a balance. So Angela, I know she has a lot of specialties as well, so I'm going to let her have it.
Come on, Angela.
Well, I specialize in pain management, so I do a lot of neuromuscular therapy and trigger point therapy. I get a lot of clients with radicular pain, and for you who don't know what that means, is you may have a trigger point, but it's you having pain down your leg, or you have a trigger point in your shoulder or your neck, and you're having pain down your arm. So it's important that you come in to get your pain assessed, because a lot of people, they'll complain about low back pain, but it could be coming from somewhere else.
Right.
So it's important that you know that, and your massage therapist educate you on that. So come on in and get some pain management, some neuromuscular therapy. I got you.
I know that's right.
I
Okay.
mean, real Angela.
We should be bartering anyway. We're
Exactly.
talking.
We all should.
And we don't do it, but we need to
We
start.
don't.
Exactly. Well, Angela's been good. She's, every 2-3 months she's been good. But... Okay, so my next question is, so why did you guys actually choose massage? Like for me, at the time, I was a personal trainer, and in my mind at the time, I had a vision of doing like a one-stop shop. I know gyms back in the day, probably more the high-end gyms, had massage therapists on site. So my vision was to actually, have a gym, you get worked out, we have personal training. And if you have one in a massage, you can also get a massage. So that was my vision, is to have massage incorporated with the personal training. So that was, my motivation of becoming a therapist. And once I became a therapist, I saw the benefits of it. And the thing that really allowed me to really fall in love with it is to see the results. Like, to actually have somebody come in with aches and pains, and then once they get off that table, like, man, I feel like $1 million. I feel great. And then to actually see the difference, over a period of time when they first came in, say from a month from now, and you can see the difference. They're walking better, their body is more erect, their posture is more, erect and just good. So for me, that was what motivated me. So I want you both to talk about what motivated you to want to, become a massage therapist.
Well, when I was first introduced to massage, a little over 20 years ago, I was in a car accident, and I was going to a chiropractor, getting chiropractic care due to the accident and due to my muscles being jacked up. And the chiropractor had a massage therapist, and I was receiving massage therapy work as well, integrated with my chiropractic care. So I was at the time that I was in the car accident, I was a nursing student, and I was actually going to school for nursing. And I started getting curious about alternative healthcare because I never really thought about it as a career. When you go to school as a kid, your parents and family members always push you to go to college and to study nursing or being a doctor, but no one talked about alternative healthcare. So I was inquisitive at the time. So I asked the massage therapist, well, how long is your schooling? Because at the time I was wrapping up my prereqs in order to be admitted into the nursing program. And, just to complete the prereqs was over 2 years. And so when the massage therapist immediately said, oh, well, my program was only 9 months. And it took them 9 months to complete a program where they were totally independent and can become an entrepreneur the next day. I said, well, shoot, while I'm waiting on admissions and acceptance to get into nursing school, I can go to massage therapy school. And because I was already in nursing, so to speak, and looking into the medical field, at the time, there was only 3 schools in the state of Georgia that taught massage. One was primarily for spa, and another was primarily medical because a chiropractor had owned that school. So I chose my avenue and my school because of the medical background, learning soap notes and, treating people with musculoskeletal problems and like fibrosis and fibromyalgia and musculoskeletal issues. So I just stuck with that, not even thinking about spa, but I just with that and fell in love with the program and was exposed to a whole new world of alternative healthcare. And when it came to Oriental medicine and so many different areas of alternative healthcare. But initially it was because I had to get treatment in a medical facility, a chiropractic facility for massage. That's how I was introduced to massage.
Awesome. Love that story.
Go ahead, Angela.
I feel like tic-tac-toe for some reason. Or the Hollywood squares. Everybody in the square. And when the
square, yeah.
I'm sorry.
Well, for me, well, my background is in physical therapy. I was a physical therapy technician in the Navy for 15 years. So that's how I got introduced to the modality of massage. And I had this one patient who came in and she was just going through a lot of stuff, like mentally and with her shoulders. And our receptionist at the time was a massage therapist. And he was like, hey, I can show you how to treat her, outside of what we were doing in physical therapy. And of course it was massage therapy with some trigger point and stuff. And I was like, man, I really want to get into this full time. So that's how I got my foot in the door with massage therapy. And then once I got off of the active duty, I was like, that's what I'm going to do. I'm going to go to school for massage therapy. I know I didn't want to work for anybody. Because after being on active duty for a while, you're like, man, I'm tired of people telling me what to do. So that was the entrepreneur aspect.
I'm with you.
So, and I looked at how much she healed after adding the massage into her treatment. And that's what I was like, I'm in love with massage. That's what I want to do.
Okay. All right. So, Angela, I know you said you maybe saw a little bit of the podcast last week. I'm sorry, not Angela, Erica. So I don't know if you saw the part when Mark was talking about his coworker, and how he was just like totally against getting a massage. So how would y'all handle that? Like if you had somebody that you know just totally against it and like, well, I'm not getting a massage, I don't see the benefits from it. I know y'all spoke on it beautifully, just a minute ago, but just like real world scenario, how would you actually, I'm gonna say convince, but how would you, motivate this person to actually get a massage?
Well, I find that in massage and in the spa industry, period, you're educating folks constantly, day and night. You're educating people on the benefits of massage because, years and years ago, 20 years ago, when I got started in the industry, majority white people were getting massages. Black people were not. They always looked at it as taboo. And so they looked at it at the point where masseuse, and when I got into massage, the state of Georgia didn't even require it to be a license.
Right.
So, you had a lot of shady establishments in the state of Georgia at the time I got into the industry. So it was a constant battle for me, having to educate people. So as long as you educate people, I like to do the fairs and the festivals, and anytime there's a health fair and I'm able to, put my hands on people, I watch people the way they walk. If they have musculoskeletal dysfunction, I immediately put them on a table. I don't even take a massage chair when I do health fairs and events. I take a full table so they can lay down, get the benefit of acupressure, and I'll introduce them to massage, doing acupressure and then stretch therapy, so that they can see how stiff they are and the benefit of regaining their flexibility. And once they get off that table, I put my hands on them with the acupressure, loosen up the muscles a little bit, and help them regain just a tad bit of flexibility. People are convinced. I'm able to book an appointment at the festival or at the health fair, and majority of the time I have them to go ahead and pay for their appointment at that time. So, I mean, when you're educating people on the benefits and you're showing them by complimentary, just a 2-minute complimentary massage or even a stretch therapy session, then most of the time, I'm able to convince people to go ahead and book an appointment. So that's been my experience.
Yeah.
Love it.
I agree with that. I was going to say, I always start with stretch therapy. And then we go from there. And I do a little compression on their shoulders and stuff like that. And they like the way it feels. And then they're convinced to come on in for a massage.
That's why I had you all on here, because y'all just seasoned, articulate very well.
Spoken. Yes.
Okay, but this is what I want to ask y'all now. You kind of led into it, Erica. I talked about this last week a little bit. Now, what is the difference between masseuse and massage therapist? There's still people out there that says masseuse. It irritates me. I can't stand that word. I really do. But for you two, just talk about it, like where it originated from and why is it such a hard job right now to try to get rid of that word masseuse? Because I was watching a podcast the other day, and the guy that was on the podcast says, I have 2 masseuses. And I'm like, man, it's not a masseuse, it's a massage therapist. So I just want y'all to talk about that.
Well, Matthew, he might have had 2 masseuses. But a lot of times when people come to me with that, being that I'm educated, certified, licensed, and a national provider for instructing massage, I have to nip it in the bud from the get-go. I have to let them know and educate them because not everyone is educated on the. So you have to look at it at an enlightening point. You have to let them know that there is a difference.
Right.
And you know, we are trained as massage therapists, but a masseuse may not have had hours of training, learning muscles, ligaments, bones. You know, I almost feel like a doctor when I finished massage therapy school because, you know, I went to a school of clinical background. Mm-hmm. So we had to learn as if we were chiropractors. And, you know, there was no let up on that. So, you know, I have to, just like I just explained it to you, I have to educate other people when they, you know, are miseducated and they come with the masseuse mentality. I'm like, no. I am not a masseuse. You have to pay me as the licensed, you know, person that went to school for this. And you will not, I repeat, you will not be getting a happy ending here.
Yes, indeed. Yes, indeed.
Maybe down, you know, at the Asian spot, but not here. Yeah.
You just put them out there like that. You're going to get me in trouble. No, I'm just.
Yeah. I was going to speak on that too, but. Yeah.
Angela, what's your perspective on this?
I don't get really offended because some people just don't know. They just associate the word with massage therapists. The only way to get around it is just educate.
Right.
And just say, hey, the only happy ending that you're getting here is the happy ending of your service. That's it.
I like that. That's good. That's good.
Something with that. It's very therapeutic, but the only thing that we can do is really educate. Because I've had male clients come in thinking that they were going to get a happy ending, and at the end they're looking like, yeah, that's it. Yeah, that's it. I'll get dressed and meet you outside. But it's the number one thing. The only thing that we can really do is educate and let people know, and just stay professional. And that nips it in the bud right there.
Okay. All right. So with the 9 therapists down there, I know you had something to say. He said that was in not your lane, but.
Well, yeah, when you spoke on the that go down to the Asian, that's what I was going to speak on. Is there a difference on that? Because actually, as a client, that was a happy ending. I have to confess on that, and it was Asian. So since Matt kind of put it out there, I'm gonna ask that question: is there a difference as far as massage therapists where you go? Because being a client, I went to a few where they did provide the happy ending because that's what I was told from a friend of mine. This was years ago, by the way. It's like almost 10 years ago. So I guess the question I'm asking is, when you have a client come up, like we did speak on a minute ago, and they expect that, do you tell them in the beginning, or you wait literally till the end of the massage therapist session to end to tell a guy, or you know, that you're not going to get a happy ending? Because the one that I had, actually, she acknowledged that in the beginning. She said, well, you would like a happy ending, just let me know what you need done. So I could tell that was very unprofessional. It just didn't seem right. But when you have a guy come in with that mentality, do you, again, just tell him in the beginning, this is how I am, don't expect anything, or you don't even acknowledge it at all because it kind of put it out there, if that makes sense?
Well, for me, I don't acknowledge it at all. Like, you can tell during the service. Sometimes they come in and they're filling out. Now, I've had some people message me and just ask straight up, you know, and I'm like, no, don't ever contact me again, go somewhere else, and then I block them. But to have somebody, the thing is they'll say, oh, they have leg pain on the inside of their legs.
Right.
So what I do is I massage their hip adductors, because those are the muscles on the inside of your leg. So when I stop, that's when I realize, oh, you wanted something else. Nope, it's not gonna happen. I don't actually say it to them. I just, you know, finish the massage and then that's it. And then I can tell by their demeanor that that's what they were expecting.
Okay. All right.
And my experience and my history of doing massage, fortunately, I have not had a lot of inappropriate situations. So that is
it's your energy.
That's good though.
But the few that I suspect could have gone that way, again, it's about educating the person that's on the table. Now, I educate from the time of the phone call. So if someone is seeking that, they give you, unfortunately, I have gotten those phone calls where I could block it. You know what I'm saying? I can nip it in the bud before it even comes through the door. But, a lot of instances I was working for other people, so I don't know what kind of phone calls they got, or how they handled the calls, because I never went through training with other establishments that I worked for. But being that I have my own massage practice now, and I had a massage business when I first started in this industry 20 years ago, and it was Optimal Life Wellness. And so people almost knew that it was medical. Right. So it all comes in the name of the practice. Now, my spa is called Massage World Med Spa. So a lot of times that might deter someone that's looking for something else. You know, and that
that makes a lot of sense.
And then, when you Google the med spa, people are looking for IV hydration. We have a nurse practitioner that works in my office. So that might be the deterrent and why I don't experience a whole lot of that uncomfortableness. Now, I do have a client. Matter of fact, I had a client this week. He was a young man that came in for a massage and probably wasn't expecting to be aroused, but he was aroused. Now, how I handle that is I drape them appropriately, almost like a baby. I drape them to the point where the sheet is so tight that they know ain't no hanky-panky going on.
Right.
You know what I mean? So I wrap that sheet around their legs so tight.
Right. Straight jacket.
And tighter to the point where, the blood ain't even circulating correctly. And then they, it might be a turn off, and then they might go limp. But, but a man is a man, and I don't want to take that away from him. So if he does get aroused, that's not a problem for me, because I know that he's a man, and that, but, like I said, I give a subliminal messages as to, it's not going to go that route with the draping. And I don't ever, kick them out or anything. If they get an arousal, it's normal for a man to get an arousal.
It can happen.
Yeah.
I want to ask both you ladies this. I'm sorry. Now I'm gonna ask you this. Now, have you ever had, or actually I'm gonna ask all three of y'all, Matt, you included. I was told full service was the trigger word. Now, is that in the massage therapist language to say full service? That makes a difference? Is there a difference to that? Or was that just for expecting that extra?
It might be, because I never used that terminology before. So you might be right about that. I've never talked to a masseuse before, so I don't know if they approach that situation.
That's what I was saying.
Right. No, I haven't. So I guess that's the key word. So
that's what I figured, because it was a masseuse, but she said, did you want a full service? Now, remember, this is back when I just started going into getting massages. So to me, I was ignorant. So I thought that was typical in massage therapists or masseuse world. So I said, yeah, give me full service. So that's when I was enlightened at the end and got the pleasure of the happy ending. But that was coming from her. I didn't even introduce it to her. So I know this is a question y'all can't answer because y'all don't do that. But I guess what I'm trying to ask is, that's where the stigma comes, where it's hard for massage therapists, because y'all have clients that had services like that, and they come in. You made a perfect point when you were saying the name has a lot to do with it, because it sounds more professional, more medical when you have that term in there that you alluded to. Because the one I went to, the name itself didn't sound like it was kind of legit, but it was new to me.
That's your red flag. That's your red flag. The name of the establishment will tell you a whole lot, And then too, I've had a Hispanic guy. He barely spoke English, and he called and he said, "Do you do massage?" And so I was like, yeah, this is Massage World, so yeah, I do massage. And so he said, no, do you do massage? You
Right.
know,
Yeah.
like, okay, what are you talking about? And so then he went on to say, but do you do extra? And so when he said that, that was like,
Right.
oh,
They like,
I said, oh, I see what you mean now. I said, no, not here. Down, maybe, around the corner somewhere. But yeah, not here. Sorry. And so he was like, okay, thank you. And he hung up. So you can basically nip those kind of clients in the bud on the phone if you're aware and you nip it in the bud from the get-go. Mm-hmm.
Okay, I want to kind of shift the atmosphere a little bit.
Okay.
Y'all spoke again beautifully about the benefits of massage, why it's important. So unfortunately, and I feel kind of like reluctant to actually speak on it now because y'all came from an area as far as how positive massage is. But unfortunately, that's why this podcast is called Day and Night, because there's a positive side, but with positive, there's going to be darkness too.
Right.
So now for the negative side that comes with massage. Now I can speak on this because, as you know, Erica, we work together and I experienced the accusation of inappropriate touch.
Right.
Now, this is important to me and it's really heartfelt because I experienced this firsthand. So for me, not to separate men and women as far as massage, but there is a certain stigma that comes with men that does massage. And I know you're a football fan, so we all know what's going on with Deshaun Jackson. Even though that's on the other side of it, he was the client and he's being accused or was accused of inappropriate touch. Now, for me, for the young therapist that's coming out, when I first got to the establishment we worked at, I was fresh out of school. Now, even though I'm an older adult, I'm still a man. So when I was actually in school, they spoke on it, you got to be professional. And this is where I made my mistake. And this is what I want all the young therapists out there, especially men, to know. One of the most important things is communication. Like, you have to communicate when you're on the table, especially when it's a female. Because as y'all know, as therapists, and you spoke on it earlier, as far as the adductors, and the adductors come all the way up to the pelvis. So if a male is not communicating with that female client, I'm about to do your adductors, are you okay with me doing your adductors? It may get kind of close, but there's no, hanky-panky, nothing going on, but I have to get to that insertion point. So if I brush or whatever, it comes close, if you feel uncomfortable, let me know. So it has to be constant communication to let that client know that what it is that you're doing. And there's no actual, inappropriate touch or intention to do so. But the other side that I want to speak on, as far as with these Facebook videos that's being put out, Instagram, and this male therapist that's claiming that they're therapists, and they're attaching massage therapists to what they're doing, and it's nowhere even close to massage. Now, there's one guy that's out there. His Swedish is pretty good. He act like he's doing a good Swedish massage. But where he's inappropriate and crossing the line is they have them in compromising positions. They're fully, naked, or they just have a towel on them. But there is a service out there for people that want that. And unfortunately, it is what it is. There's people out there that's looking for that. But I think that's where the masseuse and the massage therapist is stained, is because there are actually people out there that's doing this. I know some massage therapists that has told me, yeah, I do extra on side because it's more money. Mm-hmm. So I didn't really want to bring this up because there's going to be some therapists out there that feel as though like, damn, what, dude, really? Like, why are you putting us under the bus like that? But it is what it is. It's the truth. It's the reality of it. There's therapists out there that's doing this, men and women, and they're making big bank off of it. So I want, you to talk about it as far as how do y'all feel about it and what is the best way, not for the clients, but for the therapists. Because like I said, you got young therapists coming out, and if they get in contact with somebody like, hey, you can make extra money on the side, nobody won't know, you can do your own thing. So how would y'all approach that?
I'm glad. That's why I'm glad you had this podcast, man. Because we need to address these issues and these
Yes.
people and these, so-called massage therapists out here on social media. Fortunately, you have brought the podcast in this type of massage to light. Where my son, my very own, my oldest son, is in school right now for massage therapy. So he was so excited about the podcast. He wanted to listen in, and I told him that, there has to be some editing. But but we had to discuss, the fact that there is people out there that are doing this, and because, they have been drilling them about appropriateness, ethics, regulations when it comes to the industry. He's just totally focused on ethics when it comes to massage. So he hasn't even seen what's going on social media. I bring that to light to him. And he's all the way in Houston, Texas. We'll be starting a massage world in Houston when he finishes school. But yes, you do have the unethical part of it. And unfortunately, the women are demanding that. So we have control over it. So all we can do at this point is continue to educate people that there is a difference and that it does exist, and you're no part of that. As a man. And you have to make sure that you're draping correctly. You have to make sure that women aren't uncovered inappropriately. And unfortunately, with my son being, coming out into this industry, I have to constantly talk to him about the inappropriateness of the fact that there is a line drawn and there's a difference between the male therapists in the industry and the female therapists in the industry, because men do get a lot of backlash from that. And it's unfortunate because, I get a lot of appointments. Unfortunately, I have a lot of female therapists that come and work for me, and I don't have a lot of male therapists. But if I did, he would get the backlash. So it has to be addressed. It has to be the public has to be educated. And, hopefully we can make sure that we differentiate between ethical massage therapy and one that's not, so that women know that there's a difference and that they will feel safe and they'll feel comfortable when they do come and they are booked with a male therapist and they don't resist. Because, you got male therapists that are hurting in the industry because of, and they don't make the money. They have women that'll turn them down left and right because, they feel like they will be touched inappropriately. So, as long as we keep educating people and letting people know that we have male therapists out here that are educated, that do follow the guidelines and the regulations of the industry, and that they're, that they need to make a living and feed their families just like all the female therapists. Hopefully, we can change that mentality when it comes to those unethical practices.
Absolutely. I agree. Just like you said, a lot of people still think it's taboo, even though you have a lot more people in our community that is coming in for their self-care and their massage appointments. What I would say for a professional male, it's probably best to start out to partner with a female. That way, if a female client is coming in the establishment, she won't be so afraid to have a massage by a male. I've even seen women who massage in lingerie. They have advertised it, and they were Black women. I was like, wow. And I couldn't, me and Matthew was having this conversation. I was like, those people can't have license, but he informed me that some people do have license, and they're still doing it the unethical way. Because when I was in school, they talked about it. You can't even be associated with it. Just, you have to target your clientele smartly and educate them and let them know, hey, it's professional massage only here. Nothing. If you want something else, you got to seek that seek a escort service or whatever. But
Mm-hmm.
I hate the fact that they even call it sensual massage. Like, why
Right.
even put massage on it? Because now, if a male comes to me and he's thinking that, he sees the males doing it, so he's going to try to find a female who does it, and it sucks for us professional massage therapists who are doing it ethically and morally the right way.
Right. Okay, so I'm just curious as far as what are y'all perspective or opinion on the whole Deshaun Watson situation. As a therapist, like, how do you view that? Do you view that as you believe he, not saying that our opinion has any, weight in it, but do you believe that he actually done something? You feel as though the therapist may have kind of twisted the truth a little bit? Because I know there was several that actually admitted that they did have consensual relationships.
See, like I've been saying before, all throughout the podcast, a woman knows when a man is seeking other things, and you can put protocols in place to nip it in the bud. Like I told you before, I've had people on the table erect and hard as a rock, but I draw the line,
Right.
and I do everything in my will and in my power not to have those conversations, not to let it be unprofessional. I make sure that the draping is proper and that they know that, okay, this woman mean business. She ain't so that's probably why I don't, I am a stickler about Black excellence and making sure that I portray Black people in the spa industry in a professional and ethical manner. So that's probably why they feel uncomfortable even coming to me with that from the first place.
Right.
So I don't even have a lot of problems.
Okay.
So but you definitely have to make sure that you are not having those conversations, because the conversations can go. I mean, if you have a man on
left.
Yeah.
and he wants to talk, I'm a talker, so I'm
Right.
going to talk, but I know when it strays. You know what I'm saying? You have common sense when it comes to that. So I feel like it's the therapist's fault when you allow for a situation to get out of hand, and I feel like they were all out for money.
Yeah. Exactly.
And that's the thing too with a lot of people wanting celebrity clients. Sometimes you got to be careful with what you ask for.
Yes.
Because there's a lot of power there too, especially if you only after the money. And you can say, no, I will tell you this. I don't know who the celebrity was, but I had another therapist from another state reach out to me and say, hey, it's a celebrity coming into Atlanta. And this was back when I was doing mobile, but he doesn't like a sheet. He likes a towel. And right there, I knew that it was something. She was trying to tell me something without saying it via text message. And I said, oh, well, I'm not comfortable with that. So no, you're going to have to find another therapist.
Right.
So you have, like you said, Erica, you got to control that session and your environment. So even if the conversation does go left, it's your job to bring the conversation back or stop the session. Hey, I'm sorry, we got to stop your session because I don't feel comfortable.
Right.
Especially as a female therapist, it can get really crazy sometimes. And you just have to redirect that conversation or end the session for your safety.
Love it. Okay, so it's getting close. I want to get Angela out of here, but before we do go, I want both of you to address this. So as far as what's up and coming for both of your business, and where do you see yourself taking the massage industry? Like, where do you want to push it as far as adding to it? Just anything in general. Just like, where do you see massage going based off of your business and where you want to take it to?
Well, I can say for Massage World Med Spa, I'm all about educating the spa professionals and anybody that wants to open a med spa. So I am educating with lymphatic massage. I am now a a nationally board certified instructor. So I'll be teaching lymphatic massage as well as other modalities of advanced massage techniques to licensed professionals going forward. I also have implemented a yoga studio, so we'll be launching yoga memberships in September because flexibility with the muscles is an important part of health and self-care. So we'll be implementing group fitness classes at Massage World Med Spa down in McDonough, and classes for continuing education, because of course, as a licensed massage therapist, you have to renew that license every other year. So I will be making sure that I provide CEUs for licensed professionals, and hopefully, with my son going to school for massage now, we'll be expanding into the Texas area with Massage World Med Spa. So yeah, we got a lot of things up and coming. If anybody wants to follow me on Instagram at Massage World or book appointments, you can definitely reach out to me on Instagram at Massage World. And Angela, I know you got good things.
Yes, well, Exec Level Massage and Beauty we are promoting wellness in the workplace. We're working on contracts right now with these warehouses and distribution centers starting here in McDonough, Georgia. It's a reason why people don't want to go back to work. Right. It's not just the commute, it's about the morale of being at the workplace. Mm-hmm. So we are starting to get our contracts with the warehouses around here in McDonough, Georgia. We're going to start locally first, and then we're going to expand from there, because wellness in the workplace is needed.
Yes, it is.
A lot of people, they go to work every day, they take care of their family, and they just go from one thing to the next. They go from work, then they go straight home to take care of their kids and whatever else they have going on. So we want to promote that, and that's what Exec Level Massage and Beauty is doing.
Awesome. Ladies, again, I thank you for taking the time out, for being on this podcast. Everything y'all said, for the viewers out there, definitely, I'm telling you, you're doing yourself a disservice if you don't go to Massage World, if you don't go to Executive Level Massage, correct?
Yes.
Okay. So I'm just saying, y'all doing a disservice if you don't. These are two amazing women. As y'all see, are very articulate, educated, high energy. And again, I thank you humbly. And hopefully y'all will come back on.
Thank you for inviting us. Thank you so much for having this podcast.
We definitely will.
All right.
Thank you.
All right. Y'all enjoy your evening.
You too.
Bye.
They wonders of the world, they monsters. The twin Tompkins, brought out only born. They travel the world stopping at the brink of dawn daily. The iron's pumping. I bring you no brothers, about to bring you their life. Look no further, everybody, cause it's day and night. Let's go.